As everyone knows by now, President Donald Trump has contracted, been treated for, and recovered from COVID-19. Whether you like Donald Trump or you don't like Donald Trump as a person, the fact remains that he is the sitting president of the United States. And for any world leader to die while in office of an illness like this is a really big deal and needs to be avoided at all costs. So of course he got special treatment that you or I would not receive if we were to be treated with COVID-19 today. So let's go through these presidential treatments and compare them to those of John Q. Public. I'm Dr. Rachel Johns, an internal medicine doctor specializing in hospital-based medicine out of Southern California. I've been on the COVID front lines since the very beginning, so I am as experienced as any other doctor in this pandemic that's lasted less than a year. So please subscribe to my channel so you don't miss any of these COVID updates. So President Trump got 8 specific treatments for his COVID-19 diagnosis. The first one, which is the most special treatment that you or I would not get, is Regeneron Pharmaceuticals Antibody Complex. It's a mixture of 2 different antibodies directed against COVID-19. It's still in clinical trials, so it is not available to the general public yet. The FDA did give special approval for Donald Trump to receive this, so it was on the up and up, but they're not going to do that for anybody else. According to Regeneron, this antibody complex is meant for mild to moderate cases of COVID-19. It is not meant for severe hospitalized patients who are requiring a large amount of oxygen, or patients on a ventilator. It doesn't work for them. According to the company, the injection is meant for mild to moderate cases of COVID-19, not for severe cases. It doesn't help people who are already on a ventilator. So ideally, you would receive this antibody injection before needing to be hospitalized to prevent being hospitalized. So what they're finding in the study is that it decreases the viral load in your body, it decreases your symptoms so that people are going less to the doctor's office and to the emergency room by about 57%. So that's pretty huge. Before you get too excited about this upcoming treatment, let's talk about the flip side though. So instead of you going through this disease process and developing your own antibodies that will last for years and years, then the doctor is then giving you external antibodies to fight the infection. It's good because you will recover faster, and ideally it would prevent the complications of coronavirus. It would prevent you from having persistent long-term symptoms known as long hauler syndrome. But it doesn't confer any long-term immunity. So after about a month or so, these antibodies look like they're wearing off, and then you are susceptible to getting it again. The second treatment that President Trump received was a drug called remdesivir. This is an antiviral drug that was originally designed against Ebola. So they were doing clinical trials. It actually didn't work very well for Ebola, but it was safe. So what it is that it mimics one of the building blocks in the viral replication cycle, and so it jams up that production line and it stops the virus from replicating, giving your body more time to build up its own immunity and kill off the virus. So it decreases the duration of symptoms, and it also has been shown to decrease the progression of needing a ventilator by about 45%. So that's pretty huge. So last spring, Gilead, the company who makes remdesivir, was able to dust it on its shelves, get it out to the hospitals fairly quickly. It received emergency use authorization from the FDA for wider use on August 28th, and recently on October 22nd, it received full FDA approval, so now it's used in all hospitals. Again, it's used in hospitalized patients needing oxygen. It's not for very severe cases like the antibody complex. Once you're already on a ventilator, it's really too late to use. It's also not used in mild cases that are not needing the hospital and not needing oxygen. So when we look at President Trump's case, he was hospitalized only because he's the president, and we need to be, more on top of things than anybody else. But he really didn't qualify for needing remdesivir, but he got it anyways because he is the president of the United States. Number 3 is dexamethasone. This is a steroid that is not the steroids you use in the gym to bulk up. Those are anabolic steroids. This is an anti-inflammatory steroid. This was found in a study out of the UK. They were doing studies on all kinds of different treatments at the same time. And what they found was that dexamethasone was really good at decreasing symptoms, decreasing progression to the ventilator again, but it had a mortality benefit of 20 to 30%, which again is pretty big. So it's used in hospitalized patients, it's used in patients needing oxygen. It's not good for patients who have mild cases who are not needing the hospital. So when we look, we know that steroids actually blunt your immune system. So we don't want to give it to mild cases. We want their immune system to work well. But in COVID, what happens is you get a hyperimmune response called a cytokine storm around day 8 to 10. And that is what we want to use the dexamethasone to prevent. So President Trump's physician stated that he started steroids because President Trump's oxygen levels went down to 93% on 2 different occasions. Doesn't really require steroids. I wouldn't have given it to him, but again, he's the president. We throw everything in the arsenal at him to make sure that he lives. Everything else that he got was over the counter. So he got zinc. Whether or not this is helpful, we really don't know. I know it's in a lot of over-the-counter cold remedies, and some people swear by it. In a 2010 study, they did find that zinc did stop the replication of the SARS coronavirus in a petri dish. Again, petri dish, not a human being, and this was not the same coronavirus that's causing COVID-19. Earlier this year, there was a randomized, double-blind, controlled trial, which is the best kind of trial there is, looking at cold symptoms versus in patients who took zinc versus patients who took placebo, and they found that there was no difference. So let's talk about COVID-19 specifically. Seems to be helpful in patients who are zinc deficient. Now, most Americans are not deficient in vitamins and minerals because it's fortified into the foods we eat. However, zinc and vitamin D can have deficiencies. So in patients who are already zinc deficient, there seems to be some benefit. If you're not zinc deficient, then it doesn't do any good to take extra zinc. So let's move on to vitamin D, which is one of the other treatments that President Trump was receiving. Again, kind of same story as zinc. People who are deficient in vitamin D, giving them vitamin D did seem to help them in COVID-19. But if you're not vitamin D deficient, giving it to you doesn't really help. The next one is Pepcid, which is kind of interesting. It's a histamine 2 receptor blocker. It's used in treating gastric reflux. We don't know the mechanism of action actually, we don't even know if it helps in COVID-19, and even if it does, we don't understand the mechanism of action. I'm not really sure that it has anything to do with the pH in your stomach, because people who take Protonix or omeprazole, those are proton pump inhibitors that would also decrease stomach acid, those people have a higher risk of respiratory infections. So we don't really know what the mechanism is. It's not been proven that it actually helps in COVID-19. There are retrospective observational studies that people who were taking Pepcid seems to have a decreased risk of deaths in the hospital and a decreased risk of being on a ventilator, but those are observational studies. Those are correlations, not causations. There are studies ongoing that are randomized trials, prospective trials, to look at whether or not Pepcid is actually helpful. So we'll follow up on those and see what they show. President Trump was also treated with melatonin, which I find interesting because it does seem to have some antioxidant benefit and some antiviral benefit to patients who have both diabetes and obesity. Now, President Trump is obese. He weighs 224 pounds apparently, but he doesn't have diabetes. So I'm not exactly sure why they gave it to him. He doesn't seem to qualify for it, but it's melatonin. It's not going to hurt. There is a very small randomized controlled trial going on in University of Buffalo right now looking at whether or not melatonin is going to be helpful in COVID-19 patients. If it's positive, then they're going to say, well, more study needs to be done with a greater number of patients. If it's negative, then we're going to fail fast and move on to something else. The last treatment is aspirin. And I can't say that this was like a special treatment for COVID for President Trump. He's been on aspirin since 2016. When you become President of the United States, your private health now becomes public knowledge. So I looked back and he's been on aspirin and Crestor, a cholesterol-lowering drug, at least since 2016. Again, there have been retrospective observational studies showing that aspirin has some correlation benefit in COVID-19 patients with a 47% decreased risk of death. Again, that's a correlation, it's not a causation. And again, I don't know the mechanism of action. I don't know if that's a decrease in blood clots or if that's from aspirin's anti-inflammatory processes. So again, more study is ongoing, and that will be really interesting to see those results. So if President Trump was a regular person, John Q. Public, with a mild case of COVID, which is what he had, and he went to see his doctor, he would have been told to go home and monitor his symptoms. Take some Tylenol, rest, all those kinds of supportive care measures. If he had gotten worse, then he would have been hospitalized and treated with remdesivir and steroids. Again, the antibody complex is in trials. It's not available to the general public yet. And with all the over-the-counter drugs, the zinc, the vitamin D, the Pepcid, we are not using that at my hospital. If someone specifically asked me if they could be on it, I would tell them, I don't know if there's any benefit to it, but if it's not going to hurt you, then, go for it. That's fine. As far as blood clots, preventing blood clots, we don't use aspirin. We actually give a low dose of a blood thinner called enoxaparin to prevent the formation of blood clots while they're in the hospital. So I hope this shed some light on President Trump's COVID-19 treatment and why it was different from anyone else's. If you found this useful, please give the video a like, please subscribe to my channel, and I'll see you in the next video.